In mid-2014, Liberia, a West African nation, was hit by Ebola, one of the deadliest viruses known to humankind. It shattered the health system and claimed over 4,000 lives, as the nation lacked the preparedness to combat this unseen enemy. Six years later, another virus struck.
Before COVID outbreak in this country, WHO, together with other partners, supported the ministry to develop the preparedness and the response plan. WHO supported the government to have a plan in place and helped the government to operationalize the plan.
To coordinate a robust response, the government of Liberia set up the Incident Management System, IMS, a body comprising of all key health stakeholders and partners, headed by the Liberian Minister of Health, Dr. Wilhelmina Njala.
We put into place measures that will help us to begin to have a good surveillance and early detection. At the airport, there was a team placed there to begin testing, taking information, screening properly, hand washing, temperature checked, just to monitor who were coming into the country.
The government had the right plans in place, but maintaining such a huge response became a challenge.
One of the key challenges that we encountered was finances, because in order to run a response, you need to have finances to do it. WHO stepped in, USCDC, USAID. It was those partners that sat around the table with us.
When the COVID came, it was important to make every Liberian and every resident here understand that we are in this together.
The IMS structure provided all the partners and stakeholders the platform to bring in their expertise to help support the government of Liberia as they developed a cohesive plan to address COVID-19 in Liberia.
When the COVID hit, we had, of course, a UN country team meeting and agreed on how to support the response. So each agency looked at the resources they had, the comparative advantage they had, and then we came up with which areas to support. WHO, of course, led. We were there to support them. Other UN agencies were involved.
WHO supported the whole aspect, the framework of the coordination for the current response in collaboration with other partners, and reposition WHO staff from all the other programs to be supporting the government in the response.
They came in with supporting the lab, they came in with supplies, laboratory supplies, paid contact tracers, they paid active case finders.
Also, as part of its strategy, the World Health Organization, WHO, championed the training of the surveillance officers under the Field Epidemiology Program and identified chains of transmission through community swabbing, which was needful in containing the outbreak. Other UN agencies also diverted their resources to ensure that the government of Liberia remained functional.
We had to provide Zoom license to make sure government keeps on working, even in the midst of lockdown.
About 300 Zoom licenses were procured for governmental ministries and agencies. Meanwhile, the International Organization for Migration, IOM, supported in border control.
Our first mandate was to coordinate all these activities with the government. Our main target, because of the resources, was more limited on the border entries, including the seaport and the land crossing. So we train all port health staff in all these entities at all the crossings, or in all the 15 counties.
The United Nations International Children's Emergency Fund, UNICEF, got actively involved in risk communications and community engagement to ensure the right awareness messages were transmitted on public radio and television stations across the country.
We worked on defining what are the key messages that need to go out to the population through engaging young people, through engaging the women's groups, to make sure that we explain in a language that is clearly understood what COVID-19 is and what are the key practices that people have to adhere to, such as wearing the mask, maintaining a safe distance, and continuous washing of hands.
UNICEF also made much needed medical supplies available, including personal protective equipment for health workers. They also got involved in the training of frontline workers.
We have worked very closely with partners, the Ministry of Health, in ensuring that we provide the needed supplies in terms of hand washing stations for schools and also for communities, to ensure that we provide the adequate learning material, personal protective equipment for teachers, and masks for the students.
UNFPA supported surveillance and contact tracing. This was based on our experience during Ebola. We trained, I think, initially 105 contact tracers, 20 data managers, 20 case investigators, and then obviously we had to provide the resources for them to work. So we were able to mobilize vehicles. We mobilized 4 double cabin vehicles, we mobilized 5 motorcycles, we mobilized tablets and phones to give them to start the work.
UN Women collaborated with the Ministry of Gender to organize some training on trainers for the head of women's groups organization. Our main goal is to ensure women get the necessary information on prevention and protection of COVID-19.
We were able to set up a maternity center in the treatment unit, the military hospital. Well-equipped maternity center. We also set up a roving team of midwives, which was visiting POCs and the maternity center and providing services and support to pregnant women.
As the country gradually returns to normal, it is warned that keen attention has to be paid to the transition process.
We should not throw COVID response and embark on team health services. Rather, we should get a balance to stop any chance of transmission or re-importation of any case to the country, but also scale up the routine health services.
The reality is COVID is here and is very real, and we should be on our guards to make sure we don't suffer from any wave, second, third, or fourth.
They need to continue what I call the 3 Ws: wear your mask, watch your distance, and wash your hands.
It's not over until every country in the world has no COVID-19.
The country was able to defeat Ebola. The country can defeat COVID.
A lot of what we did for this COVID-19 outbreak in Liberia came from experiences we had in actually controlling EVD back in 2014 to 16 here in Liberia.
Now we've moved from the health shock. We are tackling the socioeconomic shock and possibly the shocks to development.
To support vulnerable traders, the United Nations Development Program, UNDP, has embarked on a $2 million cash transfer.
So we hope we could successfully distribute $2 million to them in different ways to be able to not only help them, but I'm sure their injection of that will help the economy of Liberia move forward.
We are going to be looking at the small businesses because they've lost a whole lot. Yes, big businesses have lost. But you're talking about the informal sector. which is huge. The small businesses, cottage industry, the street sellers, petty traders. So those are the ones that we are looking at.
So it was like a combined effort, everybody coming together to respond.
There's been strong coordination at the IMS level, led in this case by the incident manager, the Minister of Health, Dr. Wilhelmina Jala, and supported by all other stakeholders as well.
We really applaud them and appreciate them. I think they have done a good job.
Over 190 days of response have proven to be effective in flattening the curve. The leadership of the country provided the necessary environment for collaboration for a strong partnership, and the Liberian populace have definitely benefited from this unique collaboration. It is now hoped that the health sector will sustain the importance of community engagement, community participation, and most importantly, community ownership.